people out there is increasing the competence by adding a T at the end, but the fundamental part is PICNO. So what does that mean? P stands for the patient or the population. So you should ask yourself that who is the patient population that I want to focus on? Okay, because every research question should specifically focus on a particular patient group. All right, your patient group should be explicitly defined. Second most important thing is the intervention. So what is the intervention that you'd like to? You can't see your screen. You guys cannot see the screen right now. I can see the screen that I'm
We can
walking
see
over.
the screen.
Yes.
Okay, all right. Let me go on. So I stands for the intervention. After you specifically define your P, which is your patient population, now you have to think about your intervention. It should be explicitly stated. For example, let's say that you're aiming to compare the chemotherapy versus radiotherapy for gastric adenocarcinoma patients. All right. A correct PICO question should be asked like that. Your patient population in this example is gastric adenocarcinoma, whereas your intervention is chemotherapy here in this specific question. The comparison group is the group composed of people who did not get your intervention, okay? Comparison group can be either a control group or can be either a conservatively managed or medically managed group. But comparison group should not receive the medication or the surgery or the intervention that you're specifically looking on for your intervention section. Okay, so that's P, I, and C. And there is an outcome. When you look for these intervention and compare the intervention with another control group or another group, you're gonna compare them in terms of an outcome. For example, if you're comparing the chemotherapy and radiotherapy in gastric adenocarcinoma patients, how do you compare them? In terms of the overall survival that they can provide to a patient, okay? So this is what you have to do. You have to pick one specific outcome measure and compare those two techniques according to that specific outcome measure, all right? This can be many things. Overall survival, progression-free survival, and many, many other things, maybe recurrences or so on. Next slide, please, Abdurrahman. Yeah, if you don't ask the correct PICO question, that's what I was saying in the beginning of the lecture, your research may not work. And you can just put your months into trash. So we don't want that, right? And because of that, I strongly urge all of you guys in the beginning of your research, please do not hesitate to spend some time on defining a correct PICO question. Please, this is not losing time. This is actually earning some time, saving some time, because without a correctly defined PICO question, I'm telling you, your research can go to trash. I personally know some examples and I have some experiences that PICO question framework, that people did not frame their question very well, and afterward during the data extraction time or stuff, they become confused. Okay, should we add this group? Should we do not include this group? For example, you're saying gastric adenocarcinoma patients, but think about that. In PubMed or in other databases, you look for those patients and you found thousands of articles. So it's not feasible. So what you have to do, you have to restrict your patient group, and your patient population should be more focused, okay? By saying more focused, for example, you can say gastric adenocarcinoma patients above 60 years old, something like that, okay? But your patient population group should be the focus of the problem, and those patient populations should be explicitly defined. See the formulation here. In X population problem, how does intervention Y or exposure Y compared to the comparison group, affect the outcome? Please, I want all our students to write this formulation down. And after these lectures, please go ahead to the internet to PubMed or databases and try to formulate some PICO questions by yourself. Do some exercises, okay? This is of crucial importance. Next slide, please. Yeah, as you can see here, PICO can be sometimes defined as PICOS or PICOT. I'll show you some different examples as well. For the intervention, you should ask yourself, what is the primary intervention? For example, let's say that you're looking for patients, you're planning a research on cerebral cavernous malformations, okay? And you'd like to compare the efficacy of some conservative management options, let's say some medical treatment options, and gamma knife radiosurgery, okay? So which one you're trying to focus on, which one will be your primary focus? Let's say gamma knife radiosurgery. And you like to compare gamma knife radiosurgery with the conservative management options, okay? Then your intervention is gamma knife radiosurgery. And your primary patient population should be the ones who are receiving gamma knife radiosurgery, who harbor cerebral cavernous malformations, okay? Whereas your comparison group will be composed of the people who did not receive gamma knife radiosurgery, but only medically conservatively treated. And you have to compare these two groups in terms of an outcome. For example, let's say rebleeding or bleeding in the specific case. Then you can formulate your PICO question as, does gamma knife radiosurgery is more effective than conservative management options in cerebral cavernous malformations patients, in patients with cerebral cavernous malformations, in terms of preventing the bleeding or rebleeding risk? This is a formulated PICO question, for example, okay? So your intervention group can also be not intervention, but exposure, for example. Let's say that you choose familial cavernous malformations, okay? In familial cavernous malformations patients, is cigarette smoking associated with rebleeding? This can also be your formulated PICO question. Your patient population here is patients with familial cavernous malformations. Your intervention or exposure here is cigarette smoking. Your comparison here is people who do not smoke. And your outcome here is the bleeding or rebleeding. Is that clear? Okay, please keep in mind all these formulations because you're going to need it. In PICOS, can you come back to the previous slide, please, Abdurrahman? Previous, I said. Two previous. Yeah, here you see, no, one, next slide, please. Next. Two below, yeah, one below. I mean, next, please, next. Yes, stay here, please stay here. Okay, you see study type, okay? So what the definition is? Definition is what types of studies are included. In this PICO framework question is not suitable for every single study type. We're going to talk about that. So your study type will be important. So this is why they formulate the question as PICOS. Next slide, please. Okay, so PICO question can be used for two things. First, to develop a clinical question, to ask a question, to develop your study design in your research. Second, to identify search terminology. So I directly took this from PubMed, okay? So PICO can also help you to identify keywords to use in PubMed search. You don't want to use the entire clinical question as your search terms. Instead, you want to pull out the most important and defining words to optimize your search results, right? So let's take a look at the example by PubMed. What they said. Looking at your clinical question, we can pull out those keywords from the PICO application. See, are patient education programs effective in increasing patient exercise in the population of patients age 65 and older with high BP? So look what they picked: patient education, exercise, and high blood pressure. So a patient population, the intervention, comparison group, and an outcome, okay? This is also very important. Next slide, please. Yeah, sometimes they formulate the question as PICOT instead of PICO. So what's the T? T is type of study or question. What time periods should be considered? What study types are most likely to have the information you are seeking? What clinical domain does your question fall under? Next slide, please. Okay, so PICO question is of crucial importance, but PICO question can be asked for original study designs. It may not be appropriate for all the study designs. As you can see here, this is what? Evidence-based medicine pyramid. So I strongly urge all of our students to know all these, okay? These steps should be definitely known. Okay, let's start with the bottom. In vitro and preclinical studies goes on with expert opinions, case reports, and case series. So case reports and case series, guys, are descriptive studies. So in the beginning, you can divide this study into two parts: analytical studies, okay, experimental studies, and observational studies. Experimental studies and observational studies. In experimental studies, the main example is randomized controlled trials. So randomized controlled trials, what is it? We always talk about RCT, RCT, RCT. So let me give you a small example on what RCT is, okay? In randomized controlled trial, you have two groups. And as the primary researcher, you modulate, you give some drugs, you administer some drugs, you do something to these patients, you interfere. You are in it. You are giving the patient the drug, and you're not giving the drug to other patients, okay? You are the primary driver in the RCT. You have two groups. One group is exposed to the drug, but you are giving the drug. Other group is not exposed to the drug, okay? So in experimental study, the primary researcher is active. Whereas in the observational side, let's talk about the observational side. In the observational side, what do you have? You have descriptives versus analytics. So you have to know what observational descriptive studies and analytic studies are. Observational descriptive studies are composed of case reports and case series. So in case reports and case series, you basically publish some cases which are interesting, and you say that I have this type of case. For example, I have a giant hydatid cyst of the brain, 26-year-old patient who came from Kenya, and I operated them, blah, blah. And you talk about some techniques and importance. That's it. You just describe what's happening, okay? But you don't have any analysis. So there is no PICO question for case reports or case series, because you only publish what you have. In case series, for example, you have 6-segment posterior stabilization patients, like 50 patients, and you like to publish your results for 60 patients. For 60 patients, you may have many different results. You may have complications, and you publish your complication rates, you publish your recurrence rates, you publish your success in terms of preventing the patient postoperative pains, right? These are descriptive studies, so there is no PICO question. Whereas in the analytical counterparts in the observational study designs, what do you have? Now you start to have case control studies, prospective and retrospective cohort studies, and cross-sectional studies. So what these are? Let me give you some examples. So prospective cohort means you have two groups again. Right now, you recruit some people to two groups. One group is exposed to something, whereas the other group is not exposed to something, okay? So, but keep in mind that what is the main difference from RCTs? In prospective cohorts, the main researcher is passive. You do not expose these patients to something, but these patients expose themselves to something. The very nice example is smoking patients, right? You got one group of smoking patients, the second group is a not smoking patient, non-smokers, and you follow them for 15 or 20 years or whatever, and you see them if they get lung cancer or not. This is the famous example for prospective cohorts, right? Keep in mind that main researcher is passive here. Whereas in retrospective cohorts, you go back in time. For example, you're working in a hospital in Cairo, okay? In your hospital, you just go and find your patient files from 15 years ago, and you find again two groups, who smoke and who does not smoke. You took those two group of patients and you follow that back in time, like ahead of time for 15 years. But keep in mind that you recruited those patient files, not patients, and those patient files start from 2005 and comes towards 2020. But that time is already past, in the past. So in retrospective cohort studies, you can by analyzing the patient files, you can finish your study. In prospective cohorts, it'll take 15, 20 years or whatever. You got to follow those patients to see if they have lung cancer. But in retrospective cohorts, you already have your results and you can see whoever get lung cancer and whoever did not get lung cancer, okay? Is that clear? It's very important. It's very important. And let's give an example for cross-sectional studies, okay? Let's see that you're in Istanbul in X hospital in neurosurgery ward, and you like to know if there's any possible correlation between osteoporosis and vertebral compression fractures, okay? And you just go at the ward, sixth floor, and you find 50 neurosurgery patients, and you just screen whoever got osteoporosis. And you write that, okay, out of 50 patients who are under care in neurosurgery ward right now, 30% had osteoporosis. You're giving your incidence. So this is the main thing about your cross-sectional study. Cross-sectional study is just one time, one section in the time. You just see, you just report whatever you see, okay? This is another type of analytical study designs. What about the case control studies? Case control studies, you recruit two patient groups now. For example, you recruit patient groups who have lung cancer now and who does not have lung cancer now. And retrospectively, you go back and see if they smoked or not. So that's a different type of study design. But these are original study designs. Although PICO question is not suitable for case repository series, it's definitely suitable for case controls, retrospective and prospective cohorts, and RCTs. As you can see in evidence-based medicine pyramid, when you go up above, your level recommendation increases. So it's very important to ask a correct PICO question in case controls, cohorts, and RCTs, all right? Okay, if you have any question, by the way, please do not hesitate to interrupt me. You can just throw any questions at me anytime, okay? Next slide, please. Okay, so as I said, guys, this is an essential guide. Please, 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 if you're not aware of what the steps of the evidence-based medicine pyramid are, please, after the lecture, I'm just talking to our students. Please carefully examine what these all steps are and try to learn where systematic reviews and meta-analysis come, because those are on top of the evidence-based medicine pyramid. Okay, next slide, please. So you should ask yourself, what do I want to research on? Why do I want to research? What is my aim? While starting a research in neurosurgery, you have to have a question in your mind. Without a question, you cannot just start researching. So what do? I attend conferences, I attend grand rounds, and many other things. And I have a notebook for myself. I just write down any questions that bears in my mind. Okay, I'm trained in neurosurgery in Turkey. Now I'm working in the United States, but I got my specialty training, so I can ask some questions in terms of the specific occasions in neurosurgery. Okay, so please try to be active, go attend the conferences, and try to listen to people who are experts in their fields. Okay, asking the correct PICO question also requires some expertise in your specific field. Next slide, please. So you should start with a PICO, of course. Formulate your question. And for systematic reviews, this slide is define your inclusion and exclusion criteria is next. And then you should develop a search strategy using mesh terms, and you should locate the articles. And also your PICO question, as I showed you a couple slides ago, will help you with extensively help you to develop the search strategy, because you will be able to pick the correct keywords out of your PICO formulation. What is next is to select studies and data extraction. Then comes the risk of bias analysis. I think Yeet, a friend of mine from San Francisco, will give you that lecture, so I'm going to leave it to him. And then you will analyze your results. Next slide, please. Yeah, a good research question, guys, I always say that, should be clear, doable, specific enough. It should be complex yet feasible. Okay, so what do I mean by clear? You should not be bizarre. You should be as specific as possible. For example, let's assume that you're asking a question, okay, for grade 2 or grade 3 atypical meningiomas located on the parasagittal line, so parasagittal atypical meningioma patients, is stereotactic radiosurgery superior to surgery? It's not specific enough. So in stereotactic radiosurgery, there are different types of modalities. So do you mean gamma knife? Do you mean cyber knife? Do you want to research on some specific grades, 50 grades, for example? You got to be more specific. Also for your patient group, patients who have grade 2 meningiomas and atypical meningiomas. Or not all atypical meningiomas are grade 2, but most of them are grade 3. So just don't be bizarre, be clear as possible. And also your questions should be doable. For example, let's say you ask a PICO question and you start to do your database researches. And the database research, you found 2,000 articles. So will you be able to read all those 2,000 articles? I can assure you, no. You won't be able to read them all. So if your question gives you 2,000 articles, it means you're wrong somewhere. You please go back and reassess your PICO question, okay? You're wrong somewhere. You're making a mistake somewhere. Either you need to have a mentor who takes care of your questions, who looks and examines your questions, or please reassess yourself what you're asking, what you're trying to formulate. You're having a mistake somewhere, okay? And also, by means of doable, if you're sure that you're not having a mistake during formulation of a PICO question, if your every step is correct and you are having 2,000 articles, then the problem is you are not specific enough. So what I would do in those occurrences is I'd love to restrict my patient population or be more specific with my intervention class. Okay, is that clear? Next slide, please. Next slide. We already talked about that. Okay, so PICO questions should have some more features, which is called finer. So please be aware of finer criteria, and let me introduce you the criteria. Finer criteria means F is feasible. So I was just talking with you about 2,000 results versus 200 results. If you are three people, three students who are trying to conduct a systematic review, 200 articles will be feasible for you, whereas 2000 is not. If you have time to read all the full texts of 2000 articles, then okay, but mostly it's not feasible. Please, specifically focus on the feasibility. Next question is interesting. Finder's I stand for the interesting. So a question should be interesting. What do I mean by that? For example, also interesting and novelty comes almost always together. So let's think about you're asking a question of again, is smoking associated with lung cancer in young patients below the age of 35? Is it interesting? No. Is it novel? No. Because we already know that smoking has a strong association with lung cancer. So why asking this question is 2026? It does not make any sense. Or let's assume that you're trying to ask a question about how to define or how to assess the cerebral arteries malformations in terms of grading or so on. Is that a question anymore? Everybody uses Spessler-Martin grading, and Spessler-Martin grading system plus low to young grading system just guides you towards what to do with that patient. So it's not feasible anymore. It's not known anymore. Or let's assume that you ask a question about epidural hematomas. What to do with epidural hematomas? Is surgery superior to conservative management? Sometimes people are asking those types of questions in clinics, in outpatient clinics as well. But these are questions asked before. So please focus on the novelty of your questions. Also, your questions should be ethical. For example, you cannot formulate a question about the efficacy of, for example, methotrexate in pregnant patients with articular disease, oligoarthropathies, or some, let's say, systemic lupus or rheumatoid arthritis. You cannot do that in pregnant patients. If you want to compare the methotrexate with other groups, you cannot administer methotrexate in pregnant population. You know that. So this is not ethical. It should be ethical, all right? Also relevant. Next slide, please. So feasibility, I directly took these slides, these visuals from Elsevier. See what they say about feasibility. Feasibility is all about the practicality of a study. It's about asking whether the study can be done given the available resources, time, and technology. It's crucial to consider if its sample size is attainable, if the variables can be measured effectively, and if there are enough resources, including funding and expertise, to carry the study through the completion. You need to have the resources as well. You need to have the money and the funding, and you need to have a mentor which is an expert in your area. In neurosurgery, for example, I would not recommend you guys as students, just by students writing a review or starting a study by yourself. But I strongly urge you to get a mentor to yourself who can guide your studies, okay? Also, essential considerations. Does the available time frame allow for the execution of the research? Does the necessary technology and knowledge exist to facilitate the execution of your study? One crucial question is, can I pay for it? Because you'll be needing funding in most of our countries, in Middle East, in those areas. We cannot have enough funding to pay for our studies. There's another problem. If you require some funding and if you don't have the money, don't even start doing your research without securing the funding before, right? So we might study yield the desired level of impact and significance for the intended audience. Is there sufficient access to the desired group or an adequate number of participants to ensure the attainment to reliable results? Very important points. Next slide, please. So yeah, your study should be interesting, like I told you. A study needs to captivate the attention of not just the researcher, but also the wider audience. For example, during the COVID time, people start to ask questions about COVID time, and nearly everything researched on the relation of COVID with some other modalities. I think we have a question. How can we determine whether a question is ethical in more complex situations, especially when dealing with diverse populations such as the United States? Ethical views may differ significantly, and what sources or frameworks would you recommend consulting to establish an ethical basis for deciding whether a question is appropriate? Yeah, this is a very, 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 very important question. That is exactly why you need to have your mentor by your side. You should not decide by yourself. This is team decisions, guys, okay? You should discuss everything with your team. And sometimes, which is very critical, even for the case reports or for case series is definitely needed, but even for case reports, the IRB approval, the ethics committee approval is required, at least for some journals that I know. For example, ACTA Neurosurgical, you need to secure an ethical consent, ethical approval before sending your case report out for publication. So for your research questions, ethics is an important issue. And I would strongly urge you to discuss these with your mentors, but not just decide by yourselves. It, of course, has some cultural differences. For example, in the United States, will not be same as Turkey. It's not the same, I can tell you that. So yeah, this is a completely huge topic to discuss. But please don't decide by yourselves, because even some specific hospitals and specific institutions can have specific regulations for the ethical framework. So please discuss this with your institution and with your mentor. Okay, your study should be an interesting study. Interesting study is like a story that needs to be told. It's compelling, it's engaging, and it's added a rich layer to the existing body of knowledge. So this is the main thing. In your introduction section, I always tell my students that you need to give us a story. You need to tell us what is the importance of this study. At the end of the introduction section, you should always tell that. Why do you think your study worth publishing? Why do you think your study is worth publishing? Okay. It should address a critical gap in the literature. So in the introduction section, you should start with the topic. You should explain the topic a little bit, and you should focus on what is the gap in the literature and how your study is aiming to fill this critical gap in the literature. This is of crucial importance. This is what an interesting study does. Also, novelty. Please give me something novel in my table, okay? Don't tell me smoking is associated with lung cancer. I know that. Don't tell me I should operate or I should embolize or I should conservatively manage the subtotal hematoma patients. Just tell me something new. Next question. Next slide. So ethical, yeah. Ethics is the cornerstone if any credible research. Like I told you guys, although I personally know many journals may not ask you for ethical approval, ethical clearance for case reports or single case reports, some high quality journals, some top tier journals do. So it differs from journal to journal. It differs from institution to institution, culture to culture, and from country to country. So you need to be aware of the specific regulations of the country that you're conducting the research. It differs, but one thing is universal. Every study should align with Helsinki Declaration. Okay, if you're not familiar with the Helsinki Declaration, please go online and read about that after our lecture. Okay, the next thing is relevancy. Relevance ensures that the research resonates with the real world, okay? It's about making sure that the findings of your study is not just theoretical, but practical implications. It's more or less should be, what translational study is. It should be translational. If you conduct your study in vitro environment, if you're conducting a study in preclinical environment, please make sure it can be done in the real world scenarios. Okay, it can be implicated to the real world scenarios. It should be translational. It's also what translational means. Next slide, please. Yeah, go ahead. Next slide. So, like I told you guys, you should focus on what is your aim, what type of study you're trying to conduct. Will it be original study? Will it be a review study? Because for systematic review studies, you got to ask a specific type of question. For scoping reviews, you again may ask a specific type of question. But for narrative reviews, that you don't have to have a specific method section like systematic reviews have or meta-analysis have. You may not ask a specific question. For example, narrative reviews can be just written about the efficacy of gamma knife radiosurgery in low grade or grade 1 meningiomas. And you can just basically generally talk about the issue, the gamma knife, grade 1 meningiomas, and talk about their efficacy and what's been published in the literature. But you don't have to compile everything published in the literature as you do in the systematic reviews. Okay, this is important. Next slide, please. I think there should be some visuals, but I don't know what gone. Some. Okay, next slide. Next slide. Something is wrong with the slides. So, yeah, you should examine the types of articles accepted by journals. For example, I brought some examples to you from World Neurosurgery Journal. You should be aware of what types of articles out there before you start writing an article, before you start writing, formulating a PICO question. Because some specific journals have some specific types of articles that you can start writing. For example, let's see, World Neurosurgery accepts historical vignettes. So if you have no previous experience on writing historical vignettes, but you have some specific topics in your mind, you can write historical vignettes and send it to World Neurosurgery. I do it sometimes. But without knowing historical vignettes are the type of article that you can write, how can you start writing it? So please be active. Please check the journals, the main journals in your specific field, for example, neurosurgery. And also, please check the current conferences and try to attend those conferences and try to follow what's going on daily in neurosurgery. Which epistemic and clinical benchmarks should be applied in neurosurgery to distinguish genuine knowledge, generating innovations from incremental adaptations of established operative clinical frameworks? Can you explain this question more? I just didn't understand what you meant by it. I'll go on in the meantime. I want you to be more specific, please. Okay, so let's keep checking. You have technical notes here that you can write. For example, specific operative stages that you can write. Or if you find, for example, if you approach the jugular foramen in an endoscopic way or from extreme far lateral way, and you'd like to write the technical difficulties and the steps of the approach, and you can write that and send it to World Neurosurgery Journal. So technical notes. Literature reviews, and you can see some invited only article types in different journals. For example, they have some book reviews here, perspectives, and those type of articles are usually only written by the invited people. Okay, and you have what? Doing more with less. So some articles from LMICs, for example, you may not have operative surgical microscopes, and you can just try to define how to do this surgery macroscopically, and you can write that and send it here. Also, video articles, women in neurosurgery, even great hospitals. You may not even heard of great hospital articles, but there are some very precious in very old hospitals throughout the world, that you can even write the history of the hospital or capabilities or availabilities inside the hospital. Next slide, please. Okay, so see, neurosurgery, nursing, case reports, letters, early career forums, neurosurgery and arts. Look at that. And some more invited topics. And development of neurosurgery. See, there are many different types of articles that you can conduct and that you can send to the specific journals. Next slide, please. Okay, so you formulated your PICO question, and now what you have to do? You have to do the transition from research topic to research question. Next slide, please. For example, for chronic subdural hematomas, for us, for all neurosurgeons, it was until a couple of years ago, it was the main thing was the surgery, right? Main thing, main treatment option was surgery. Either burr hole surgery, one burr hole or two burr holes on both sides and stuff. You're placing the surgical drains and going off. It was a very easy surgery, but we were having complications. These patients were having some recurrences. Coming back to us, we'd have some complications too. And what happened a couple of years ago, MMA embolization have been shown to be effective in chronic subdural hematoma management. Okay, so this was something very novel. We were surprised because as you all know, chronic subdural hematomas were thought to be originated from the rupture of bridging veins. We thought it's venous bleeding, but it's been shown that middle meningeal artery can be the reason, or at least one of the reasons, in some of the chronic subdural hematomas. So it's been shown that embolizing MMA were effective in terms of curing the disease. I mean, preventing the recurrences, and it's minimal invasive. So now, throughout the world, MMA embolization for chronic subdural hematomas began to be known as the primary treatment modality for chronic subdural hematomas. Next slide, please. Okay, some examples. Something is wrong with these slides. I think it's just slide it down. I don't know why. Sorry about that. Originally, it's not like that in this slide. I have some animations for you to show one by one. All right. Anyway, so are adolescents with substance use disorders more prone to traumatic brain injury? So this is a good format question. What is your P here? Of course, that's adolescents. What is your intervention and what is your comparison group? So intervention or exposure is substance use disorder. The comparison group is adolescents who does not use substances. And your outcome will be tendency to TBI. Next slide, please. So these are actual article names which I took from PubMed. The effect of internet-based cardiac rehabilitation on anxiety, depression, and quality of life among patients with ischemic heart disease. So P here, your patient population here is patients with ischemic heart disease. Your I is intervention is internet-based cardiac rehabilitation. Your comparison is the group who did not get this intervention, the control group. And your outcome here is anxiety, depression, and quality of life. Next slide, please. Yeah, the examples can be increased in number. Let's say some very basic examples for you to understand the concept. Do ACE inhibitors lower BP in patients with hypertension? This is not known. We all know the answer. But this is just to tell you, just to show you examples of how formulating these questions. For example, intervention here is ACE inhibitors. C, comparison here is placebo or lifestyle modification. Outcome is reducing the blood pressure. So you can formulate a back question as in adults with hypertension, do ACE inhibitors compared with placebo reduce blood pressure? So your patient population is adults with hypertension. Your intervention here is the ACE inhibitors. Your comparison here is placebo group, and outcome will be the reducing the BP. Next slide. Again, please see them as simple examples. These examples are just for you to understand the concepts. Does mechanical thrombectomy improve outcomes in acute ischemic stroke? So your patient population should be patients with acute ischemic stroke. Intervention will be mechanical thrombectomy. Your comparison can be IV thrombolysis alone, and you should compare these groups in terms of mortality or functional independence or MRS scores or whatever. So your question, in patients with acute ischemic stroke, does mechanical thrombectomy compared with IV thrombolysis alone improve survival and functional outcomes? This is a correctly framed PICO question. Next slide, please. Again, is endovascular treatment safer than the open surgery for unruptured aneurysms? So your patient population will be the patients with unruptured intracranial aneurysms. Intervention group is endovascular treatment, or coiling or whatever, can be standing or anything else. C is microsurgical clipping. Outcome is complication rate and mortality. So your correctly framed PICO question is, in patients with unruptured intracranial aneurysms, does endovascular treatment compared with microsurgical clipping reduce complications and mortality? Next slide, please. And there are many other examples. Next slide, please. These are just examples for you to understand the concept. These are actual published papers that I took from PubMed. For example, comparative effectiveness of multi-component exercise interventions on cognitive function in people with cognitive impairment. C. People with cognitive impairment, here is your P of your PICO question. Your I, your intervention is multi-component exercise interventions. Okay? Your C group is the group who did not get multi-component exercise interventions. Your outcome will be the cognitive function. Next slide. And a correctly formulated PICO question also gives you a title for your article. Keep in mind that. Okay, these are more examples. Next slide, please. Yeah, I already answered this question for you. Do you need a PICO question for every study design? The answer is no. But for most of the original study designs and systematic reviews, meta-analysis, RCTs, cohort case controls, you need a PICO question. Only for narrative reviews, case reports, and case series, and those type of descriptive studies, you may not need a PICO question. Next slide, please. Yeah, I have already told you the differences between the experimental and observational arms of study designs. In experimental group, we had RCT, remember, and in RCTs, we are active. In observational arm, we have descriptives versus analyticals. And in descriptive part and analytical part, the main researcher is passive, okay? Yeah, and you should be aware what is an analytical study and what is an descriptive study. Next slide, please. Yeah, please assess the PICO suitability, and please further examine the study type or main study design that you want to conduct, because you have to know what these descriptives are versus analyticals are. Okay, next slide. Okay, you're planning a systematic literature review, okay, or meta-analysis. How should you formulate the appropriate research question? Articles such as systematic reviews and narrative reviews with synthesized literature can be written on a wide range of topics. For example, you can just pick unruptures unruptured intracranial aneurysms, and you can write all about them, how to define them, their incidences, their demographic information about them, what percent of population or what percent of gender distribution does they have, how to manage them, do we need to operate them, how often we need to do imaging for these types of lesions and stuff, and many other things. When a PICO question is posed, the results found in literature should allow for development of a review. For example, you formulate a PICO question, you conducted your literature search, and you only find 2 articles, 3 articles. It means either you're making a mistake during formulating your PICO question, or you're making a mistake during formulating a PICO question for the search strategy. You may have mistakes in your search strategy, or you may have mistakes in your PICO question. So you got to go back and check every steps that you are following. For meta-analysis, quantitative data must be available. This is very important. If you do not have poolable, homogeneous quantitative data, you cannot conduct a meta-analysis. You cannot compare apples with pears. Everything needs to be either apples or pears. So you need to be very homogeneous. Okay, next slide, please. After defining your PICO question, you should create your database search query, and this is going to be your next week's or next month lectures. Which databases? There's no limit, but the main ones we use is PubMed, Embase, Cochrane, Scopus, Google Scholar, Web of Science, etc. Next slide. These are recommended articles. Please read them. If you have further questions for PICO formulation, PICO, please read these 2 articles. These are very helpful. I like both of these articles. Next slide, please. Yeah, here I brought more and more examples. For example, in patients with moderate to severe traumatic brain injury, does the comprehensive craniectomy compared with standard medical management improve 6-month functional outcomes? Blue here is your patient population. Red is your intervention. Green is your comparison group. Whereas 6 months functional outcomes is your outcome. So I hope it looks easy for all of you right now. Next slide. In patient with GBM, does maximal safe resection compared with biopsy alone improve overall survival? Your blue here is P. Red is your I, whereas green is your comparison group. And overall survival is your outcome. Next slide. In patient with lateral pointing camels, does surgery through safe entry zones compared with conservative management reduce neurological morbidity? So your blue, again, is your patient population. Your red is your intervention group, whereas your green is your comparison group. And your outcome will be neurological morbidity. Next slide. Next slide. I've given you many examples. If our students like to do some hands-on practice on formulating PICO questions, there is a free practice opportunity in PubMed. Just take a screenshot of this link so you can go to PubMed and practice by yourselves. Next slide. Here I took an example from PubMed. So this is what PubMed makes you practice. They give you a scenario, and you can just think about the following scenario and use PICO framework to create a clinical question. So see what they did. P, patients age 65 and older. I is patient education. C, no patient education. O is the outcome. So patient participation in exercise. So I hope it looks easy for all of you after our lecture, guys. Next slide, please. Yeah, this was probably the very last slide. So we had one question. Basically, which criteria would you say distinguish genuine innovation from gradual repetition in neurosurgical research? So, guys, these days, especially at the latest years, innovation are being defined by AI, deep learning algorithms, the segmentation studies, and machine learning algorithms and their definition and application in neurosurgery. So, in neurosurgery, you should be reading the top journals at least, Journal of Neurosurgery, the Red Journal, and Operative Neurosurgery, and the others. I mean, JNS Focus, World Neurosurgery, and so on. You should at least be reading those very up-to-date articles to be able to see what is currently going on in the area. But I can tell you that in most of the journals, and please check the journals call for papers. So most of the journals these days are accepting articles about AI and AI-assisted segmentation, AI-assisted patient decision making, and case-based discussion through AI augmentation. And yeah, it's also depending on the era that you're living in. If it was a couple of years ago in 2020, 2021, I would tell you, please just go online, try to examine the COVID's relation with neurosurgical diseases and so on. So it's so specific. It requires you to follow what's going on in your specific field, and please try to be active and try to attend the conferences and read the most important journals and the articles that are being published in those journals. Yeah, thank you very much. If you have any questions, just throw at me. Just do not hesitate if you have any questions, guys. Just ask me.
Okay. Uh, to Dr. Kıvanç Yangi, for your excellent and insightful presentation.
Thank you.
Kıvanç Yangi, and you for his time. It's brightest and for sharing his knowledge with us today.
Thank you.
Thank you so much.
Thank you, guys. Do you have any question, or are we just ending the finishing lecture here?
No, it's will end. It will end a question.
Okay, I think I see no questions. Thank you very much, Abdurrahman. Thank you very much, guys. So again, thank you for your kind invitation, and I'd be happy to help any of you. If you have any questions, just you can reach out to me either directly from LinkedIn or from X or whatever. I can text you my name. You can find it through X, also from LinkedIn or from Instagram, doesn't matter. So you can reach out to me if you have any questions specifically. Thank you very much again for your time, and it was a great day. Thank you. So yeah.
Goodbye, guys.
Thank you.